All right, good morning, Healdsburg Sunrise. Welcome all, and let's kick things off with an inspiration from Dan.
So I stole this from Jeff Bezos and the Amazon annual report. It's a quote from Theodore Zeus Geisel, also known as Dr. Seuss. When something bad happens, you have three choices. You can either let it define you, let it destroy you, or you can let it strengthen you.
I like that. Thank you. Let's jump right into our speaker. For this week, we have Joan Churchill. She's CEO of the Alliance Medical Center, a recent transplant to Healdsburg, and started just as all this came down. So I suspect it's been an interesting first several weeks on the job. Joan, welcome to the club.
Thank you. Thank you, all of you. I'm so glad. I was saying to Lance, I was so glad to actually be able to talk to people because I did start on March 16th at Alliance, and that was the same day that, at least in the healthcare world, that the COVID-19 exploded, and we actually had to drastically reduce hours of our dental program on that very day. So that was kind of a sad thing to do. I have a PowerPoint, and I have a colleague who should be joining us any moment. Her name is Sue Labby. She's our medical director, and I don't see her name on here yet. So we'll just take it as we do. So I do have a PowerPoint. So Lance, I'm not sure if you have to give me permission to share screen. But before I get into the PowerPoint, I just want to tell you just the weirdest bit about me. I've lived in New England all my life. Have an older sister who, when you live in New England, especially in the 60s, California is the promised land. And my sister moved when she was 20, and I've been visiting her ever since to San Francisco and then Northern California. She lives in Santa Rosa. So I've always wanted to live here, and finally the stars aligned, and I'm so glad to be part of this community. So we're Alliance Medical Center. I hope all of you, at least you can notice the building. We're right beside the hospital, and we are a nonprofit, federally qualified health center. And strange here, we were originally incorporated way back in the early 70s to address the health needs of the local migrant farm workers. That has shifted over time. Right now, probably a small percentage of our population, of our patient population, identify as a migrant farm worker. I think that's because most of the farm workers in the region live in the region. But we do have a large Latino patient population, and we just have a lot of minorities as well as majority patients. We serve over 12,000 in the surrounding communities, as well as obviously in Healdsburg and Windsor, where most of our practices are. Our medical care, even though you see on this list, we provide a lot of different kind. It's primarily primary care for our medical and obstetrics, and we have part-time people or full-time providing chiropractor, acupuncture, podiatry, cardiology, gastroenterology, and you can see the rest. So we have a lot of different specialists coming to us, or we employ them. We have a large dental program and a growing behavioral health program. We also provide the WIC, the Women, Infants, Children's Family Nutrition Services in Sonoma County, in many, many communities in northern Sonoma County. So all told, like I say, we serve well over 12,000 patients a year. Of that, about 40% are children, the rest are adults. So we're a federally qualified health center, along with about 1,400 other organizations in the country. And in exchange for getting what we call an enhanced Medicaid or Medicare rate, we are obligated and want to, by our mission, to offer a sliding fee scale for people with no health insurance or people with high deductibles so that their healthcare can be affordable. And it's just a really great thing to do. Where to find us pre-COVID? So if you were looking for us and wanting our services and wanting to go to our services pre-COVID, we have 4 offices. 2 are being used now in the COVID time. So our flagship is right next door to the Healdsburg Hospital on 1381 University Ave. We have this wonderful large space that I don't know, maybe about 20 years ago, you folks might know better. We partnered with the city with a Department of Agriculture loan to have this building, and we have a long-term partnership with the city to stay right in that wonderful space. We also have a smaller space on another, I believe it's a city-owned property on 1557 Healdsburg Ave with a lot of other nonprofit organizations. We call it our Comprehensive Wellness Center, where a lot of like our chiropractor, acupuncturists are. In Windsor, we have a medical practice and a dental practice right in one of the shopping centers there, the Palm Shopping Center. We've temporarily closed the dental practice in Windsor and the wellness center. And our, as I'll show you in the next thing, during the COVID time, we're at the 2 medical clinics, a Healdsburg one, and we're offering a great deal of our services through either telephone or televideo. And this is, as I'll tell you in a few more minutes, a real new world. With the telephone, we're just as close to you as whatever phone is in your pocket or, you know, at your home. The televideo, same thing. We can reach you and talk to you about your healthcare needs via your smartphone, your laptop, you know, iPad, Kindles, whatever it is that you have. We're now able to be able to see you and talk to you that way. How we've moved Alliance to the new future of healthcare came with a big crunch. You know, the world changed, the shelter in place happened in mid-March. People stopped going to anything either because we told them to. We couldn't do dental anymore except for emergencies. And most people did not want to come out. And we were also pretty much asked by the state and the national and everyone else that only really urgent needs should be taken care of in our clinics, that everyone else should just stay home. So we were very lucky that literally the Friday before the shelter in place happened, we had a new phone system installed. It's called Jive. I don't know, I'd never heard of it before, but it allows us to use our phones from home in a way that they're still our office phones and they're all hooked up with the internet in these magical ways, so that we really weren't able to miss much of a beat. After about 2 weeks of figuring out how to do it, we've moved back up. So by the end of March, we have 2/3 of our healthcare visits, or not March, but by now, we have about 2/3 of our healthcare visits conducted either by telephone or televideo. And we do expect that to grow. And we are able to see a lot more people at our clinics using all of the different safety features that we have to do. We started a COVID testing program very, very soon after. We would have tested likely a lot more than 100 patients had we had the testing equipment or the testing swabs. As you may have heard, that was all very tightly regulated for the longest of times. Today, if we need to test one of our patients, we can. We have enough testing swabs. If someone asked for us for a test who wasn't our current patient, we likely would be able to do that too. We are very, very thrilled to tell you that of the patients that we've tested, everyone has been negative. And these were patients that had screened that they could have COVID. They either had a fever or they had some kind of a symptom. So it told us that, at least for our patient population, COVID hadn't spread in the community yet. So It's a good thing. Our staff have not had COVID either. So, I think that Sonoma County has done such a wonderful job in having the shelter in place come down immediately and just protecting us as much as possible. So we're really happy about that. Like I said earlier, we had to stop the dental program. I learned a new word my first week, and that was aerosol and aerosol generating procedures. Maybe you heard when shelter in place started that a lot of the surgeons, there were different things in the hospitals that they couldn't do, but did we know that it would affect our dental practices across the country? I learned that the first week. And so we are retooling now. The whole idea of that type of thing is when you come to your dental appointment, wherever you go to see a dentist, there are a lot of things that are aerosol producing. Having your hygienist work with you with those nice little equipment pieces, having a cavity filled, all sorts of things. So all the dental programs in the United States, we're now trying to increase our airflow and do all sorts of things with the building, as well as we're all going to look like space people. When you go to the dentist next, they're going to be outfitted as if they were going to surgery. So it's a whole new world. We're still trying to get there. We have a lot of upgrades to do on our HVACs to be able to, again, do aerosol producing. We're ramping up right now to do non-aerosol producing things, a lot of exams, a lot of all sorts of things that I don't know the technical terms of. But when you go to your dentist anywhere in the community, they'll probably be asking you a lot of questions to see if they can do that type of thing now or later. But we're using our Alliance to the Future toolbox. We are doing all our meetings on either Zoom or we discovered with Jive that we actually already owned Outlook Teams, which is a really even faster way than Zoom to do meetings when you're in an organization. We have a lot of our providers working from home. I think all of our behavioral health counselors are working from home. Maybe half of our providers, medical providers are, and they're able to, work with 20, 24 patients a day through either the telephone or the televideo visit. So it's a whole new world. Let's see if I can get this thing to go. Okay. COVID really has changed the delivery of healthcare, we think, forever. A lot of our partner organizations do too. People really like not having to go to the doctor if they are feeling not great and they're just describing symptoms. If it's some certain kinds of chronic care things, behavioral health actually increased about 20%. For two reasons. One is a lot more people who are stressed. The second reason is it's a lot easier for people to make their appointments when they just have to pick up their phone rather than trying to get their bodies to one of our counselors. We hear that sometimes it's easier for people to talk to someone they already know a little bit, so they've met their counselor already or knew on the phone or in a televideo visit rather than being in person when it's some, anxiety and depression thing. So it's really a whole new world. We still have, we're still working on, because a lot of things are back ordered, being able to allow anyone who wants to come into our practices to do that. There are just so many people with very high risks that we want them only to come in when they absolutely have to, for a test, for something, if we have to touch them to see if there's a lump, for things like that. But we're trying to do everything else over the phone just to make it easier and safer for people. And my guess is when you go to your providers, the same types of systems will be in place. We've been able to maintain most of our staff because of the small business PPP program, and because of some federal funds that came down to us. Those supports end in September, and we really need to make sure that we're, as we're doing, we're revved up so that we can continue to generate, probably, 80% of our revenue is patient service revenue. And because we're an FQHC, we get some federal funding, but it's at least 80 to 85% of our budget is, revenue based. So my last note here is that there's a lot of community members here that may be losing or have already lost their health insurance. And we just certified or had certified 2 staff to be enrollment counselors to help community members navigate health insurance options when they lose their employer-sponsored care. So that's something that we hope that people will avail so that we can help them. Sue, are you by any chance on now?
Yep, I'm here.
All righty. So I'd love for you to continue the presentation, explain a little bit what this wonderful picture is, and maybe you can just tell me to click, and I'll click more pictures.
Sounds good. So good morning, everybody. I'm Sue Labby. I'm the medical director at Alliance. And I just wanted to kind of take this opportunity to share with you how we are practicing medicine. As Joan mentioned, the modalities that we're using to practice medicine now have radically changed since the onset of COVID. And so we're using virtual tools with video. We're also using telephonic visits. Some of our providers are practicing in clinics. Some are practicing off-site. But it really allows us to bring the medical care to the patient. So this is actually a picture of one of our family practice physicians who is working with a patient to help monitor their blood pressure at home. So the blood pressure device that the patient is wearing is actually part of our self-monitored blood pressure program that we launched after the onset of COVID, because we recognize that we care for a lot of patients with chronic conditions, including hypertension, that we were really concerned about being able to control their symptoms remotely. And so we sent out remote blood pressure monitors to those patients. And then we were able to actually work with the patient to use the monitor, titrate medications, and make sure that they have the tools that they need in order to be successful with that. This was actually we chose the monitor we did based on our cardiologist's recommendations. She has a mother who lives quite a distance away, and she was monitoring her mother's blood pressure using the same device and was very happy with the results. And so when I was looking at devices to use, this is the one that she had really recommended. And the patients have been really grateful to be able to do this, and it really empowers them to be a partner in their care. So it's been really a helpful thing. If you want to go to the next slide, Joan. All right, so this is one of our behavioral health counselors. One of the things that we did right away as soon as kind of COVID hit was to switch all of our behavioral health staff to be virtual. And so either video or telephone for all of their sessions. Some of our more high-risk population of patients that we serve are patients dealing with substance use issues, and in our what's called a medication-assisted treatment program for folks that are recovering from addiction to opioids. And so that was a high-risk population that we really wanted to make sure we did not lose in the midst of all of this. And so we've actually set up a system where we're doing a minimum of weekly check-ins with that group. We've actually relaunched our group visits for that group through Zoom. And so our behavioral health counselors and medical providers are able to continue to support that patient. And to date, none of that cohort of patients has relapsed during COVID, which is amazing because that's a really a high-risk group. So those virtual tools have allowed us, quite honestly, to save lives because some of those folks, if they had relapse, would certainly be at a high risk for not surviving. So that's been a really important tool. This is our dietitian. So she's actually had some amazing results during COVID. I'm sure we've all heard about, everybody sitting home in quarantine doing nothing but eating and not getting any exercise, but she's actually made a huge difference in the lives of our patients. She's doing virtual pantry tours and meal prep with the patients. So they're actually in their homes looking at labels on boxes in their pantry, showing them the food that they've got in their house. She's helping them to come up with ideas for healthy meals. She actually has a planned virtual trip to the grocery store coming up. So she's going to go with the patient on the telephone and help them to pick out healthy foods at the grocery store. So there's a lot of really exciting options when you can go to the patient. And, our patients are expressing they feel like they've got their own personal dietitian in their home to help them make those healthy choices. So it's really been an amazing option and something that is really best practice and having much better outcomes. So it's really exciting to be able to do that, and important that we're able to continue to do that. So it's kind of a silver lining to COVID and what we've been able to do for our patients. Go to, and this is our cardiologist who is also working from home. One of the great things that we've been able to do with our cardiology patients is, you know, even though she's at home and working remotely, we can do a lot of the monitoring in clinic. Like we can have a patient come in, do an EKG, send her the results. She can read that right away, provide them with care. She's using, of course, the remote monitoring blood pressure devices. You know, she's there to and available to consult in real time with all of our providers. She's actually made herself available 5 days a week. So anytime that anybody has a patient with any kind of cardiac issue that they need a consult on, she's available, and she'll actually even Zoom into the appointment if they need her to. So that's been a really nice thing. With a lot of our high risk and chronic patients, not only has Alliance gone virtual, but many of the other subspecialties that we refer to have gone virtual. And in our patient population, that can pose a lot of challenges. Some of our patients don't have the equipment or are not accustomed to using devices for video. And so we actually have also been able to help those patients. So for instance, we had a gentleman who was recently diagnosed with cancer, and he needed to start treatment with his oncologist. The oncologist had switched to a virtual platform, which had totally overwhelmed this gentleman, and he was not able to register for it, couldn't figure it out. And so what we did is we actually set up a computer in an exam room here at Alliance. We had a nurse sit with the gentleman, log on for him, get him all set up, and then was actually able to kind of assist in making sure that we had all the follow-up. So, you know, just trying to get creative using the tools we have to keep the patient population that we serve healthy and safe during this time. Well, this I think was going to go back to Joan, but this is just I wanted to mention. So we do some groups with our opioid use patients with the MAT. We also have several other groups, and this is pre-COVID. In the picture is our pediatrician doing a healthy eating and activity group with our pediatric population. And this is something that we're hoping to relaunch during, virtually now, and looking at ways that we can do that. I think, Joan, did you want me to speak to this slide, or do you want?
Sure. Yeah.
Okay. As I mentioned, we had purchased the blood pressure devices for our patients with poorly controlled hypertension, and we'd love to be able to continue to expand that program. It's been very well received by our patients, very well received by our providers. As far as our medical groups, we had been making a lot of success with our the pediatric and family-focused weight management programs, our hypertension control, or what we called Healthy Hearts group, and our Living with Diabetes group prior to COVID. And we're trying to look at ways, how do we use virtual tools in order to continue to make progress with this group in this post-COVID era where we can't bring everybody into these group environments. And one of the things we would love to be able to do is actually provide an incentive program with Fitbits where we could track activity for patients and be able to kind of incentivize, healthy choices in kind of a post-COVID virtual world that we're all living in. And kind of just a glance into what Alliance looked like pre-COVID. We were all quite cozy and no one was social distancing. But post-COVID, we are doing a lot more social distancing. And the picture post-COVID, this is a group of our medical assistants at our Windsor site who are wearing the beautiful mask that one of our local residents donated to Alliance team members.
Yeah. And they probably were there for 30 seconds with the picture and then had to scatter again. Yeah.
Yep.
But we want to know, do you have any questions for us?
Hi, Joan, this is Nancy. And thank you, Sue, too. That was really informative. Two things. I wanted to mention that a beloved Rotarian of ours, Max Dunn, was I think he was instrumental in getting this building put together. He was the executive director, followed by another beloved Rotarian, Jack Newrider. So that's just a big
Okay.
that we've had the executive directors as Rotarians in our community.
Oh, I'd love to
Yeah, we
consider.
still have Jack Dunn's picture hanging in our lobby in our Healdsburg site.
Oh, that's good. I know Max was so devoted to this. The other thing is, along with all the other service clubs in our community, most of our fundraisers have been put off, killed, whatever. Are there ways that our club can help your organization or your community do things that are, well, either virtually hands-on, or when COVID when we start being able to get back into the community, things that we can do to help you that may not be accompanied by a check at this time?
Yeah, I've been thinking about that a lot. And we, there were some things there are lots of things. And one thing that it was trying to figure out is, as we're starting to welcome back more dental patients, this week is our first week of non-urgent care dental patients. And as we start adding more dentists on, we're going to have more people coming to our program, and we sort of need either staff or volunteers to help patients navigate where their body should be before they go into the waiting rooms, because we have to always keep people 6 feet distance, and you need to come here, you need to go there for these different screening questions. So it's sort of like a traffic stop person. And if there's ever, that's just the one volunteer that's hard for us to do when we know we're going to have more people. We definitely need people to just be our ambassadors in the community, to make sure people know that if they do lose their health insurance, they could come to us and or other organizations that we would be able to direct people to navigate them through what some of the public health insurances are that might be temporary for them, or our sliding fee scale, so that people don't have to forego health care just because they don't have health insurance from their employer at that moment. And, just being ambassadors for all of the different services that we provide, and that healthcare is still available through some really strange ways. And all of you have figured out Zoom. So that's another volunteer thing, might be to help, through some crazy coordinated way we could figure out to help our community members get used to some of these video platforms. We could have started the video faster, but we had to find a product that was really, really easy for someone to just get a text message and click on it, or an email message and just click on it and not have to do anything else. And a lot of people still don't have the perfect laptop or perfect smartphone or perfect anything for that to happen. Like my mother accesses Zoom through a Kindle, and the Kindle is really, really quirky. If any of you have that and are accessing it today through Zoom, it's just helping people so that they're familiar. And it doesn't necessarily even need to be just with our patients. There's so many people who aren't that used to technology, and now everyone's doctor's office and even everyone's dental office might be wanting to do a virtual screening with you first before they think you need to come into the office. So those are some of the things I'm thinking of. What about you, Sue?
Oh, got it.
I think you're muted, Sue.
Obviously, I haven't mastered Zoom yet. Sorry. So yeah, I think, as we ramp up, having some help with screening out front would be great. As I'm sure most of you have experienced, any public building or medical building that anyone's going into these days, we have to screen them to make sure that they're not a potential infectious risk before coming into the building. So as we ramp up and there's more and more patients coming through, that becomes a more onerous thing. So I could definitely see that being a potential.
Yeah. The other thing is food. We are one of the sites where the farms to
It's farm to
pantry
pantry.
delivers. So we always have a table outside for food, so that any of our patients can come, and as you know, they're there, or we can do a Facebook blast if we get a whole bunch. So if you know people who still have oranges on their orange tree or lemons on their lemon trees, or as things come in, you know, food is always something that's very, very helpful for our patient population, or any of the things. So don't forget us when you're in the community and find a whole lot of something.
With your telemedicine conferencing or visits, how secure are they? Can people bomb the Zoom meeting? Are there HIPAA issues or privacy issues involved with that?
So I can speak to that. So so initially when all of this came out, they actually waived HIPAA compliance, the need for it, but we decided not to go that route, just because it was very scary to me to be in a situation where we weren't in a HIPAA compliant platform. So we opted to use only HIPAA compliant platforms for all of our patient encounters virtually. So we're actually using a platform right now called doc.me, and it is HIPAA compliant. It's a direct patient to provider, and then we also, for our Zoom group meetings, those are also, we're using a HIPAA compliant version where you actually have to have a code to get in and that kind of thing, and you have to let the patient into the group, so someone couldn't just come in and bomb the Zoom or whatever the terminology is for that. And then we have a third platform, which is our MyChart platform through our electronic medical records. So some of you who may have gone to Kaiser, it's the same platform, just Kaiser calls it MyDoc or something like that. And so it's basically, and that is, you actually have to register for that platform. And that's why, as Joan mentioned, we weren't able to launch that platform as quickly as we wanted to, because it takes some work on the patient's part to be able to register for that. We really wanted to be able to help them through that process. So we're kind of got 3 platforms we're using right now to ensure that we can reach all of our patients and that we can maintain their privacy and the HIPAA compliance.
Thank you.
I'm understanding that Alliance is a primary care facility. If a patient needs specialty care, how do you handle that? Or what is your relationship, for example, with Healdsburg Hospital?
So we have a great relationship with Healdsburg Hospital and working with the Healdsburg Physicians Group, and there are some of those physicians that we refer to. We have primary care providers and subspecialty providers at Alliance. So we have gastroenterology, cardiology, osteopathy, rheumatology. We offer acupuncture, chiropractor. So there is some subspecialty care that we can provide in-house. For the stuff that we can't provide in-house, we have referral relationships with pretty much everyone, Sutter, Healdsburg Hospital, UCSF. So it just kind of depends on what the subspecialty need is. And then we already have, partnership relationships to refer to them.
Great, thank you.
Sue?
A quick question.
Morning. Yep.
I'm sorry, Tom, is it okay if I go and then I'll pass?
Please.
So I just wanted to tell everybody that as Reach for Home's executive director, we have a very close relationship with Alliance, and we've been very blessed to have that collaboration with them on the people that we serve. But one of the questions I have for you, Sue, is I attended an international trauma conference for the last 3 days, and they are talking about how much childhood trauma plays in on the ability to treat patients that have severe mental health issues, which is, of course, the population we deal with. So I wanted to find out from you guys, is there any plans to incorporate some of these modalities in the treatment of patients that are showing severe trauma from their childhood, and not just ACE scores, but really have some very difficult situations in dealing with everyday events because of the development of the brain during the time when the trauma was induced. So I was just curious what you guys are doing in relation to that.
Absolutely. So actually that was something, I think the trauma levels are going to go up post-COVID, but that was actually something that we had recognized. Even the patient population that we serve deals with a lot of trauma. Many of them come to us with, a childhood history that they've become very resilient to get through, but it has left a lot of scars. And so we actually had launched a program prior to COVID where we were incorporating, as you mentioned, the ACEs screening, which is basically a screening for childhood trauma adverse events that have affected somebody. And then when we launched that, we actually sent all of our behavioral health providers to a training for trauma-informed care because you don't want to screen somebody for something, identify it, and not be able to provide them with, you know, the appropriate care for that. So our behavioral health staff has attended that. We actually put that out to our medical providers as well, to anybody who wants to attend that training. It kind of the first part of it was in person. The second part of it ended up going virtual because COVID happened. So it kind of put a little bit of a hold on things, but absolutely very important. And I think it's going to become even more important because just this COVID event is very traumatic for many people.
Tom, did you have a question?
Yeah, I was just curious. Once we kind of go back to the new normal or whatever we're going to call it post-COVID, I was wondering which of these kind of telemedicine things that you intend to keep, maybe long-term, some of the feedback you may receive from patients that they liked that you would like to keep moving forward, whether that's telemedicine or something else, or do you kind of envision once we go back post-COVID to operate the same way that you've operated in the past?
I don't think there's a world where we can go back to operating in the dinosaur age. I mean, this really has opened, the silver lining of COVID is that we have been able to bring the care to our patients. And some of the most vulnerable patients that really are at risk, even pre-COVID, to having to leave their homes and come into a health center and all that's involved in coordinating that. If we can bring the care to them safely and provide the care that they need in their home, it's actually a much better alternative. For some of our, you know, behavioral health patients that are dealing with a lot of challenges just to get through the day, you know, getting themselves up, dressed, and into clinic at a certain time was really challenging. But if we reach out to them where they're at and they're comfortable in their homes, you know, it's a much better alternative. So I think all of the advocacy groups that I know of right now are really pushing to continue this possibility for our patients, you know, and we'll all just get better at it. I could say that in the beginning when we launched this, both our providers and our patients were very resistant. They're kind of like, oh no, I'll just wait till this is all over and I'll come into clinic. But then as this kind of went on, they're like, oh, I actually really do need care. And patients enjoy it. I mean, I shared a story with Joan previously. I had a virtual visit with a little girl who had a rash and I needed to see the rash. So we had done a virtual visit. Well, I take care of all 5 of the children in the family. And so as soon as I popped up on the screen, the entire family started crowding around and waving, and they were all super excited. It was like I had, like, you know, jumped into their home for a visit. And so, you know, and then that same family, I've now done 3 or 4 other visits with different children because they're like, oh, this is great, you know, come back to our house. So it's almost like doing house calls in a virtual world.
Right. No, it's great to hear. Thank you.
Hi, I have a question. This is Dan. Sue and Joan, your Alliance seems to be very nimble, you know, in the way you've responded quickly to COVID, and overall your organization seems like you're, because you're a smaller scale and your regional focus, your model seems to be like it might be a really effective healthcare model. Do you know how, like, your metrics or outcomes compare to more traditional healthcare models that I'm part of because I have employer-provided healthcare? You know, I'm just curious how your approach works compared to others. You seem just like you're really on top of things.
Well, it's going to take some time to have that data. I can share lots of patient stories anecdotally about where providers have shared with me the improvements that they've made with their patients during this time and having multiple platforms to reach our patients. But it's going to take some time for the data to follow. But we need that data absolutely to support the care we're doing. I know that actually a lot of our quality measures have been adjusted during COVID to really try and track that and to reflect some of the care we're providing during this time. And so hopefully that's going to then basically move to value-based care, which is a direction we've been trying to head in, but this has really pushed us in that direction. And that is the silver lining, in my opinion, of this crisis.
Yeah. I'd like to add that one of the key things as we try to reflect on why we were able to shift fast was because of the resiliency and the fires that have happened in Healdsburg over the last couple of years. The last fires when we were out of power, we weren't able to reach our patients because we didn't have electricity and didn't have this and that. I wasn't here then, but we decided we had to invest in a new telephone platform, and one that would allow us, if we couldn't be here, to still contact everybody. And the telephone platform is also an ability to text all of our patients and all of these different things. And again, we just got that installed the Friday before, and it allowed us to jump really fast. And I think that, and I know that organizations that are other FQHCs in northern Sonoma County, or not northern, but all of, the Northern California, were much slower to adopt because they had to then they had to get that too. And we had already invested in that. And we are, our organization, I mean, all of the people kept saying, you know, we got through these 2 fires and a flood, we're going to get through this next thing here. And it was a real can-do attitude. And I think that helped, you know, when Sue said some of the providers had a hard time with the telephone and the televideo, she is being very, very kind because it was the kicking and screaming, and, you know, Sue is an early adapter, and she had to show people and show them and show them and show them. And finally, I think you've got pretty much everyone. There's no laggards left, Sue, or are there just a couple?
Just a couple, but, you know, we just keep sharing success stories. And,
Right.
you know, I mean, I had one that actually ended up kind of drawing a crowd because I was doing a video visit with a 9-month-old who was just talking away, and I was literally like having a conversation with this 9-month-old and smiling from ear to ear. And so it's just, I mean, we miss our patients. We want to be able to see our patients. So being able to use these virtual platforms to actually see our patients and interact with our patients is really a positive thing. And so I think people are going to get more and more adaptive to it.
Have you had to deal with reimbursement issues for telehealth?
So the good news is with the declaration of the national emergency, we were actually able to bill for it. There were some, you know, there's always going to be some issues and some lag in how we code for that. There's lots of medical coding issues and all of that, but we are able to bill for telehealth at this point, and we're really advocating that post-COVID that continue, because right now the reason we're able to bill for it is because there is a national emergency, but hopefully that will continue post-emergency.
Any last questions before we move on? All right, well, thank you so much, Sue and Joan, for joining us and talking to us about all the work you're doing and the fascinating insight into the transition you've had to make during this whole COVID situation.
Thank you.
Thank you so much for having us.
We always do jazz hands because everyone's on mute.
That's a good idea.
All right, I think next up, Dan Erickson, we were going to have you talk a little bit about the RI Foundation activities.
Okay, so the Rotary year is coming to a close. Lance is counting down the meetings that he is in charge of, and Nancy is counting up the meetings until she comes on board. Anyway, they are asking us to consider making donations to the Rotary Foundation so they can close out their fiscal year. Just for information purposes, our club had a goal of giving to the Rotary International Foundation $4,000 this year. To date, we are at $2,226. Our Polio Plus goal was $2,500, and we are currently at $931. We recognize that there's lots of worthy recipients for our dollars, but we are Rotarians. The foundation is really great, and personally, I got to put a plug in here for Polio Plus. COVID has sort of taken our eye off the ball on this, but this is a disease that, we have the chance of actually eradicating if we can just push the, ball over the goal line. So anyway.
Yeah, I think Polio Plus is a really key one right now, in part because with COVID and, with the lockdowns, it is seeing a resurgence in many countries. And so it's going to be a lot of work to get back to where we were. So it's even more critical over this year and the next couple of years.
Yeah, and I've also heard that they've sort of taken the infrastructure for the polio and are applying it to addressing the COVID situation. So you're dealing with COVID as well as polio in this situation. So anyway, if you are so inclined or in a position to make a last minute donation here to Rotary International, they would love to have your contributions. Additionally, they have pivoted pretty well, and they've got a disaster relief fund. So they are addressing some of the situations that are coming up as a fallout from the COVID. So that's my spiel.
Thanks, Dan. Does anyone have any questions on that? All right, Colleen, can you talk about what we're planning to do for Jack Valerga's birthday, since obviously we're not going to have an in-person party?
Yes, I can. So I spoke with the head of the facility where Jack is and asked if there's a potential that we could do a drive-by and, honk our horns, have signs that say happy birthday and wave. And what we decided to do at her guidance was 10 cars is about what she thinks would be manageable there. So I said, how about if at 11 o'clock, there's 10 of us, 10 cars that come through, they have on our cars, signs that say happy birthday, Jack, and we can wave to him and say happy birthday to him. So if you're interested in doing that, if you can meet at the Rotten Robbie or the Dollar Tree, the parking lot there, and then we can get into cars with our masks on and some distancing and go and drive to Jack's. And I'll try and get some signs made. And if anyone wants to help me with that, that would be great. And then we can just put them on the sides of our car and do that. So that's on June 26th, which is, I believe, Jack's birthday. And that would be meeting at 10:45 at the parking lot. And as I said, we can only take 10 cars. So if you have a larger car, that would probably be good. And one could sit in the front seat and someone could sit behind the driver. And then we could both, or sit on the other side of the driver and we could wave out that way. So that's the plan.
And we're also planning a cake?
Yes.
Yes, that's Nancy.
I'm trying to find an edible logo. Custo charges a lot of money to do a custom Rotary logo on the cake. So if I can't get an edible logo from Russell Hampton or somewhere, we'll just write something that this is from your Rotary, your fellow Rotarians.
The places do like photo cakes. We might be able to create a PDF with the logo and just have them printed onto the cake.
Yeah, I haven't spoken with the designer, the cake decorator yet, so I expect to do that tomorrow. And I'll.
Colleen?
Safeway might do that as well, or one of the other.
Dan.
Could you qualify the meeting location for Jack's drive-by?
Yeah.
Dollar Tree, and I had Rotten Robbie. So
well, you know where Rotten Robbie is, right next to the fire station?
I do.
That parking lot there is where we would meet. So that we can, get into cars, and then it's just another minute. From so.
Perfect.
And I'm sure Colleen will send out an email with all the details to everyone.
I will, and if anybody wants to help on the art project of making signs, just cardboard that we can put on the cars or hold, whoever's on the passenger side can hold and wave. And
is this a gesture hat event?
Sure. Yes, we all love those jester hats, so of course, yes.
Mask and jester hat. That's a great combination.
That won't scare the people.
Nice. Colleen and Jay, do you want to talk about some of the 4th of July thinking that we have going on? We're trying to come up with plans for doing something virtual.
Jay? Is Jay still on?
You're muted.
Jay doesn't know how to
Silence.
unmute.
He's censored.
Nancy, you want me to talk to this?
Colleen does. She's just as good as Nancy.
I'd like to do 4th of July in a bag and just stuff it with things that the kids can use to celebrate the 4th. The felt tips and stuff, and paintable ducks, and stuff to make hats, and make that part of the parade that goes around with the fire trucks. So we could have the fire trucks follow a timed route. So you start off at, let's say, Presidential Circle from 9 to 9:30, and then move on down through the town, and have the kids come out and drop it off, and then they can post pictures of what they make as part of a sort of virtual 4th of July. We can post that on our own website, or we can, and in addition, we can have them post it to Next Door Neighborhood. Parents are getting desperate for stuff for the kids to do. And I noticed, because I follow this stuff, that all of the people who supply kits to kids just can't keep their orders filled. So it's a really popular thing. I think it follows all the safety protocols we're looking for. I believe that by putting the sponsors' names on the bag, it'll actually give them more exposure than they would have had in any other case, because normally all we do is put up a poster that says, "Thank you, Big John's." So this way they get something tangible in their hands, and we can make that really nice. It would take some doing in terms of putting it together. I got this idea from a group I'm working with, the Kaboom people, and they did it for children in Baltimore to design their own playgrounds. And it's a wonderful, very successful, I think quite brilliant. If you go to Kaboom, if you just go Google Kaboom Playground, it'll come right up, and they have a nice website that shows how they did all that stuff. So I'm not worried about budget. I think we can, maybe with Doug, we can reach out to Big John and the other traditional ones and say, here's what we're looking at, and do you want to join in? If we don't get a good response from that, we'll just table it. But if we get a good response, we could go. The problem is time. I can get most of the stuff quite quickly, but it's going to be the putting the bags together and coordinating with the city and the other stuff that has to happen. So that's from me.
Excellent. So obviously Jay's going to need a lot of help on this, and we need to move extremely fast to start reaching out to some of our core sponsors to see whether they can help us out. So please get in contact with Jay and Colleen on this so that we can start trying to execute on this. It would be great to have some kind of activity and be able to talk about the 4th of July, in a Rotary context, and keep ourselves out front and center of the community, even during this period, so that people remember us when we're hopefully all back and together in person next year. I want to give a little update on what happened at the last board meeting. Very excited to announce that the Cousteau Needs program did extremely well. So we had the challenge, the matching contributions. So we had $1,500 in match funds, and the rest of the club came up with the other $1,500. So we've sent off a check for $3,000 to Cousteau's. So I think that was very successful. And of course, they're doubling that as well. So that's a lot of bread that is getting distributed out to the community. And we talked about the Giro Vignetti, our bicycling event. Obviously, that's not happening at its original date. We're continuing to work on the website and looking at potential dates in the future, maybe early fall, Right now, that's up in the air. Our hope is that we will be able to do something as a fundraiser this calendar year, but obviously everything's still somewhat up in the air, and it may need to get punted all the way into the usual time in 2021. Nancy, I think you wanted to make some announcements.
Hi, thanks, Lance. Every week I've been sitting in with our fellow presidents-elect for the various clubs throughout our district, and we are given some very interesting information on things that are happening within the district. There is an ethics initiative being kicked off, and the person who is chairing that is William Rousseau, and you may have recognized his name on your tax bills, your property tax bills. He's our former tax assessor, and he has also handled our elections over the years. He's retired from that job, but he is a Santa Rosa Rotarian, and he is handling the ethics initiative. Oops, sorry about that. Hang on one sec.
I'll just do a quick soft chew.
I had my cell phone shut off, but not the landline. Anyway, if anyone is interested in working on a committee that focuses on ethics in the Rotary world, I can put you in touch with this person. The district is trying to reach out to get more club members involved in district projects. The other district project that they're looking for a chair for is the youth chair. So if anyone is interested in stepping out of our little community and serving on the district youth committee, they could use help there. And I'm also wondering, have you all received information on Toastmasters that the Rotary Club is pairing with? So that's a pretty exciting thing, and hopefully we'll learn more about that. But for folks who want to brush up their public speaking skills, this is becoming available to us through that partnership. There's also another organization that I'd like to look into with Andy this coming year. It's called the New Gen Peace Builders. And these are students from the various high schools who get together and work on ways to build peace in our community. And we'll learn some more about that. I think it sounds pretty powerful. So it's always fun to hear what's going on in the rest of the world of our local Rotary clubs. So that's the announcements I have from that perspective. Lance, do you want to run the vote for upcoming officers, since I'm one of them?
Sure, absolutely. I didn't have a chance to set up anything within Zoom, but we need to formally vote on the slate of officers for the new year. Nancy, why don't you rattle off who all those officers are?
Okay, so President-elect Larry Mills is our president nominee, soon to be president-elect. Colleen will be our jester, our sergeant at arms. Lance, past president. Dan is on the board representing our foundation, and he will be secretary of our board meetings. Jay Beckwith is on the board as our, I call him my conscience. And let's see, Terry, secretary. Andy, youth. Have I forgotten anybody? That should be 9 of us.
Diane.
Oh, Diane, oh my God. An unforgettable person, Diane Bucher, membership.
And treasurer?
Terry.
Terry.
So those are the officers. And then I also sent along a list of the people who have graciously offered to chair committees or events. They don't have to be voted on, but I'm forever grateful. And I will be reaching out to various members to get their support on some other items. So that's it.
Excellent. Thank you, Nancy. So we do need to take a formal vote on this. So would someone like to make a motion to accept that slate of officers? Brad signaled his, and who will second? Colleen and Mark. All in favor, raise your hand and wave. Is anyone opposed? No one opposed. Excellent. So that's carried unanimously. Congratulations to everyone who has agreed to volunteer and serve on the board of directors for the coming year, and support Nancy in, I'm sure, what will hopefully be not quite as unusual year as mine, but it's off to a strange start at the very least. All right. Are there any other announcements?
I think I was supposed to do some kind of fee fining thing for Archie.
All right. Is there anyone who should be recognized, perhaps, or who would like to be recognized for events?
What I thought, instead of us doing something like that, because of what we have all been watching unfold in the past week, I'm asking all of you to make a donation to an organization of your choice that shows our solidarity and support that Black Lives Matter, and just to do something from your own side to show, either contribute to the NAACP, Black Lives Matters, ACLU, any organization of your choice. There are plenty of them out there, but I think it is our way to show, with not just our mouths, but with our contributions, that we do care and that we do want to show that we are saddened by the lack of support that we have seen that has been going on too long, in my opinion, and it's time for us to show our support. So
that's a great thought.
Do that instead.
Great thought, Colleen. Andy, your hand's up.
Yeah, just wait, hold on. I don't know if I'm still on. I might have hit the wrong button. Just had a quick announcement. The Interact Club wrapping up its year. They had $1,400 in the bank. They were hoping for a little bit more, but of course some of their events at the end were canceled. With that $1,400, $700 went to the Thirst Project, which works on water insecurity issues around the world, and $700 went to the Healdsburg Food Pantry. They also had their little fundraiser selling shirts. They made another $150. So they donated a total of $850 to the food pantry. And right now they're working on officer elections, which of course can be a challenge, doing it over email or Facebook or whatever, and wrapping up the Interact Club year.
Excellent. And you're going to be talking to us a little bit more about some of the scholarship recipients in our next meeting.
Yes, and give you a little bit more insight into all of their accomplishments.
Wonderful. Sean, were you waving to be acknowledged?
I was. I wanted to actually thank Colleen for what she's saying, and really appreciating her thought on this, because I think it takes a lot of support in the areas that we're really talking about, and people stepping up and fessing up that brutality is really happening. So I appreciate that.
Thanks, Sean. Any other announcements?
Oh, I just wanted to ask Andy about the Thirst Project. How did the Interact Club become involved with this?
Last year, one of the Interact Club members, who was also a scholarship recipient, did some research, and she felt that it was a good organization. The club vetted them, and actually the Interact Club has started somewhat of a partnership with them. They actually sent some interns up from Los Angeles to speak to the club, and the club was actually working on a fundraiser to raise funds for the Thirst Project but unfortunately, of course, the pandemic hit, so the fundraiser never took off. So yeah, it was something that one of the club members initiated on their own, and it's resonated with the rest of the club.
It's an amazing international project.
Yes.
Wow. Thanks.
Fantastic. It's good to see positive things happening, even in the midst of everything else that's going on. All right. So next week, we're meeting June 10th. Same Zoom time, same Zoom channel. We'll be hearing from Steve Diamond, Executive Director of Matrix Parent Network. And so that should be interesting. Again, probably a lot of information about what's going on with the COVID situation. Colleen, did you have something?
So I just wanted to ask a favor that before you end the meeting, if you could go away, and then I can talk to all of these people about, you know, an event that might be coming up when a president ends their term.
Ah, yes, I can absent myself then. I'll stop the recording and leave the room.
Okay. Just give me 5 minutes when you're done, and then you can come back and shut everything down.
Perfect. That sounds great.
Isn't that a visit to the lake?
Thought. H. Jackson Brown Jr. said, "Remember that everyone you meet is afraid of something, loves something, and has lost something. Go forth and Rotary the heck out of your week."
Okay, now go away, Lance. We don't want to see you anymore.
All right.